Hey world, it's me again. I have an idea, and I don't really know who to pitch it to. I don't know if I should pitch it to an individual or a company or what I should do. So I'm just going to pitch it to everybody and see if anyone picks up on it. So here's my idea. Before I really get into my idea, I guess I should say that this may only work in the United States. I don't know how healthcare works in other countries, so this may just be a US kind of thing, but I'm not really sure. Also, for those of you who don't live in the US, I'm going to give you a brief, in a nutshell, kind of explanation of how healthcare benefits work here. In the United States, if you have a, quote, real job, you work for a company that offers healthcare benefits. There's retirement plans, there's a whole bunch of other stuff that we can get into, but for the purposes of our discussion today, we're mainly concerned with healthcare. So, back to that. When you work for a company with healthcare, the way it works is that each time you get paid, X amount of dollars is deducted from your paycheck to cover the premium of the healthcare costs. Now, most companies also kick in, they match what you pay or they pay more or whatever to cover the premium. So, for me at my last job, it was really cheap. It was like $25 a month, a paycheck, not a month, for my premium that I paid. So then I have health care. So then when I go to the doctor, I've got asthma, so I needed to go to the doctor to get a prescription for my asthma inhaler medicine. Anytime I went to the doctor for, we'll say, a physical or just a regular checkup, or I had a cyst removed from my back, that kind of thing, pardon me, I would pay a $20 copay. So no matter how much it costs, say it was $300, I went in, I paid my $20 copay, and the insurance covered the rest of it for me. But in the event of something major happening, let's say I got cancer or I got AIDS and I needed a major treatment, then the $20 copay doesn't apply anymore. It would be on more of an 80-20 type of basis, where I would be responsible for 20% of the costs of whatever treatment I might need, and the insurance company covers the remaining 80%. So that's kind of how it works. That's just a basic look at how healthcare works in the United States. So here's my idea. My idea is kind of based on the same principle, but it's for cars. So I'm going to call it auto healthcare, we'll say. I don't know what else to call it. So that's what I'm going to call it, auto healthcare. So again, the same principle where every paycheck, X amount of dollars would be deducted from my paycheck to cover the premium of the insurance, and the company would kick in the rest, or however it works. I'm not really too sure how all this works, to be honest with you anyway. I know what I pay, and I know how I pay, and when I go to the doctor, and that kind of stuff. So, if I had auto health care, then from my paycheck every month, we'll say $10 or $20 would be deducted from my paycheck, or every pay period, not necessarily every month. So when I would go in, my car would need oil change, or air filter change, or the belts were bad, or my transmission fluid was no good and need to be switched out, then I would bring it into the shop and I would pay my copay, $20 or $10 or however much it was. And but if there was something major, like say my transmission fell out, or my engine overheated and the head warped, so I had to have the head planed down or replaced, or even if I needed a tow, a lot of people can't afford the price of a tow, then that's when the 80-20 principle would kick in. I would be responsible for 20%, and the insurance company again would cover 80% of the major repairs. Let's say all four of my brake, my discs, and my drums went out on my brakes on my car. That's a pretty expensive repair. The insurance company would cover my 80% and I'd pay the 20%. That's kind of how I feel about it. Also, I feel that once this is established, companies that offered these type of benefits would get breaks or discounts on their own insurance, because that's how it works now with healthcare and that kind of stuff, is people or companies that offer this kind of stuff to their employees get discounts on their own insurance. I feel that companies where employees would be more likely to show up for work because they wouldn't have a problem with their car. They wouldn't have broken down cars because it would be taken care of. Just like their bodies. If their body breaks down, they go to the doctor, they have insurance, it's easy to fix and easy to pay for, and then you make it back to work sooner. Same thing with your car. If your car breaks down, bring it to the doctor, they fix it, it doesn't cost you $1 million, and you can get back to work sooner. This would be completely separate from auto insurance, the conventional auto insurance as we know it. And it is not designed for people who purchase brand new cars, because a lot of them have warranties that cover this type of thing already, for the first 5 years or 3 years or however many miles, that kind of stuff. So it isn't designed for them, it's designed for us, the people who can't buy a new car, who can't afford a new car. But when their car breaks down, they really can't afford to get it fixed either. So if you have some type of auto health insurance, when it breaks down, when you need these types of scheduled maintenance, it wouldn't hit your pocketbook so hard, and it wouldn't be such a traumatic experience for you. So that's my idea. I guess let me know what you think. If you think it would work, if you think it would not work, if you think it's a ridiculous idea. I hope you like my idea. I hope someone picks up on it. That's it. Thank you again for listening to me.